Welcome back to Mountain Connections. Right now we are focusing on the Peace House. They care for victims of domestic violence and do much, much more, especially with education and prevention in that realm. Today we have Jodi Peterson joining us right here in studio on the couch. Tell us all about what she does as the sexual assault coordinator, how she helps victims and also helps with other individuals in the medical field, and how all these entities work together to help people here in Park City. Thanks for being here today.
Thanks for having me.
So Jodi, tell me about your position with the Peace House.
So I'm the Sexual Assault Services Coordinator. I've been there a little bit less than a year. This program is something that actually started right before COVID hit. And so it's something that has been in the process for a long time. Unfortunately, when COVID hit, it kind of diminished our ability to get out and respond to the hospital to be with survivors because they were limiting what people were allowed in. We have a great partnership with Wasatch Forensic Nurses. They're the forensic examiners or nurse examiners who go out to first and foremost take care of a survivor's health needs, but then if the survivor also would like to have forensic evidence collected for future prosecution, then the forensic nurse does that as well. And the forensic nurses just appealed to the hospital and said, we cannot do our job without the hospital response team, which is a volunteer team of victim advocates who are highly trained to go out and accompany sexual assault survivors during that forensic exam.
So where does the Peace House come into this team? How do they all work together, from the forensics to the medical personnel to the other individuals, the volunteers that help in all aspects of this?
So Peace House, Wasatch Forensic Nurses actually reached out to Peace House a few years ago and said, we have survivors from Park City who are actually presenting at emergency rooms in the Salt Lake Valley, and that's just one more barrier for a survivor to have to get across in order to get services. And so we want to make this as seamless and easy as possible for survivors to get the help that they need. And so Wasatch Forensic Nurses were integral in getting my position. But Peace House has always been also a dual program for sexual assault survivors, and we do accept sexual assault survivors into our shelter as well. So it's kind of a natural fit for a Peace House to be in membership with this, because we're a community-based. Since we're a community-based center, we are 100% confidential. And whereas if I were working for a police department or some other systems-based advocacy program, I would be confidential in as much as I would have to disclose anything that I learned from a survivor to the police department that I worked for. So this way, sometimes when people hear that, they're like, I don't like that. I want this investigation to move forward, and I want to be able to prosecute this case. But fantastically, when you empower people and you educate people, they often have the courage to move forward with that next step of going to make a report and having a case prosecuted. And that's something that I, as the Sexual Assault Services Coordinator, can also accompany with them to if they want to go make a police report. Of course, we do have victim advocates who work for our local prosecutor's office and for our police department, and they are fantastic as well. And so that might just be a friendly handoff to those victim advocates, but we let the survivor decide how involved they would want us to be through that process.
So you mentioned you're empowering those victims. It's such an important thing to do. So Peace House comes in really a friend, a confidant, a professional that will be with these individuals every step of the way. What types of services specifically do you provide? You mentioned sometimes housing if they needed it. What other types of services do you help find and help connect these victims with?
Okay. So first and foremost, we do the hospital response team. And so that is the victim advocate who will go out to the hospital to support the survivor throughout their examination. Additionally, we put them in contact with financial resources to help pay for all of their medical expenses or any other out-of-pocket expenses that have related to their crime. And then from that point, we also can provide more of a long-term case management. That's another facet of my job, is I'm also a case manager. And so we just kind of let them dictate what they need. And so if that's, I just need somebody to help hold me accountable because I know I'm scared, I know I want to do this, but maybe if you're kind of, I kind of, I don't know, I kind of use the phrase, I'm your study buddy. I'm kind of like that person that helps you through this process so that you have the courage to do what you want to do, and to also kind of be like this other person who holds you, to help hold you accountable, so that if this is something that you want to do, that I'm like, hi, how's it going? You know, do you have any questions? Is there anything I can help you with? So, and then other facets of my job can also be, I really like doing a psychoeducational piece with survivors, because so often when somebody has been sexually assaulted, they don't realize our bodies go into just this survival phase, and they do all of these hypotheticals like, why didn't I scream, why didn't I scratch, why didn't I bite, why didn't I do all these things, and there's all of this like should have, could have kind of scenarios going through their heads. And I feel like that's a big part of a survivor's recovery, is being able to take the blame off of themselves and just understand this is primordial. This is, our bodies are designed to survive. And if you froze and you couldn't do all of those things, this is why, and kind of explaining the science behind that. I actually, I thought I was a genius coming up with this. I was working at a previous job, and I had a therapist come to me and say, hey, I would really appreciate it if you could work with this young woman. And so I just had this epiphany while I was talking to her. I formerly was a trainer, and I specialized in the neurobiology of trauma. And I had her come sit on the couch by me, and I pulled up my old PowerPoint, and she just had these light bulbs going off all over the place. And she said, you know, this has probably been more productive for me than the last 6 months of therapy, because now I'm not blaming myself.
Wow. What are the statistics like in Utah as far as sexual assault?
Yeah. Surprisingly, we are above the national standard, or the national statistics for sexual assault in Utah. The national statistics are 1 in 6 men and 1 in 4 women. In Utah, it is 1 in 6 men, 1 in 3 women. And so, yeah, we've got a lot of work to do here.
Unfortunately, we absolutely do, but having you in this position, being able to coordinate these individuals to have this incredible life-changing help for these victims is so essential. I'm going to make sure to mention that if someone's watching and they feel like they need help, if they have been a victim, what can they do? Where could they go?
They are welcome to call Peace House. We have a hotline, and I believe you're going to post that along with our website, which is peacehouse.org, and then you can go through and you can find the hotline there, and you can also find the services that are offered for sexual assault survivors.
And that hotline 24/7,
Yes,
you can call it
24/7.
anytime for yourself, for someone else as well.
Yes, yes.
Just so incredibly important. What made you decide to come and work with the Peace House? You've mentioned some things that you've done in the past. We're so lucky to have you here. But what was behind that decision?
Kendra Wyckoff, our executive director. I've been in the field for about 17 years, and it seems like I've just kind of followed Kendra around. One of my very first job in this career was working at a West Valley City Prosecutor's Office, and she was formerly the program coordinator for the victim advocacy program there. And I had just heard such wonderful things about her, and so I've kind of just followed her around throughout her career. And when the opportunity came up here to go to work for her, I just couldn't say no.
And it sounds like you need volunteers to be able to make sure this response
Yes.
team
Yes.
can happen. If someone's interested in volunteering, what can they do?
If somebody is interested in volunteering, they can go to our website. We do have a volunteer coordinator. His name's Riley Stone. He's kind of the gatekeeper for all of that, so he can let you know what kind of training is involved with becoming a member of the hospital response team. And I do want to mention that it is a very specialized position. We don't, we have to require that folks do at least a 40-hour rape crisis counselor training. Through that rape crisis counselor training, you become a certified rape crisis counselor, which gives you that confidentiality that we need for this position. But I am a training nerd. I absolutely love learning more about this, and so there's always ongoing training as well. And just, you know, for folks to know, it's not a position that is taken lightly. We do ask people to typically commit for at least a year, just because it is such a process to get everybody trained up and ready to go. And once they've had the opportunity to get through that training, then they shadow most likely with me for about 3 times, so they're not going out on their own. They're kind of seeing how I do my job and then tailoring it to, you know, whatever they feel is important, and how they show up for survivors in those moments. And yeah, it's a great program.
Well, Jodi, thank you so much for being here today. Absolute pleasure meeting you and welcoming you here to Park City Television. We're so grateful to have you and your resources and your experience at the Peace House to help victims, and I really appreciate you coming on and talking about it today.
Thank you. Thank you for having me.
You can head to peacehouse.org for more information, to find out all about how you can volunteer. Also, if you need help, you can call that hotline any time of the day or night. We'll be back with more right after this.